There is no correct way to do this. However done, it must be simply systematic and repetitive to be effective and efficient, minimising the chance that lesions will be missed and taking no longer than 3 to 5 minutes. The most essential ingredient is good lighting, and ambient daylight provision from appropriately screened windows or skylights is desirable. Artificial light should be added. 4 daylight type fluorescent tubes on the ceiling immediately above the couch in a room of standard height will be adequate. A light source, worn as a headlamp, allows the greatest flexibility and efficiency for specific body sites such as the ear canals and digital web spaces. If possible, position the examination couch away from a corner or a wall to give easy access to all parts of the body and reduce the amount of movement required by the patient. A motorised couch removes the problem of steps getting in your way as you are moving around the couch. Have a trolley within arm's reach to accommodate your dermoscope, other tools and a biopsy kit. Paint one wall of the consulting room grey and stand the patient in front of this to obtain better photographs. Discuss whether the patient wants a total examination or only assessment of the specific lesions that are of concern to them, and record their decision for medico-legal purposes. The patient must be adequately consented for a total skin examination to ensure they understand what is to happen, as many patients do not know that skin cancer does not just arise where the sun has struck them. Further explanation is required to achieve efficiency and effectiveness. It is important you control the examination. Explain that initially you will carry out a full and thorough check and will then return to address any specific lesion of concern to them. Lesions may be overlooked if a nervous or anxious patient distracts you from your systematic examination process by pointing out specific lesions. The patient must feel comfortable. Ensure that the room is warm, the examination couch is clean, and a gown or sheet is provided. Ensure that the patient has privacy for undressing and dressing. If required, call a chaperone in. For each area, initially stand away and scan the skin, making a general assessment of the level of solar damage and number of nevi, and also looking for the ugly duckling. Then focus in on any lesions which have attracted your attention using magnification or dermoscopy where appropriate. The system demonstrated here starts with the patient prone. The scalp is assessed first using the focal lighting device and parting of the hair to allow the skin below to be seen. The ears and retroauricular folds are also checked. Next, move to the posterior neck and back, the buttocks and legs. Pay attention to the toe web spaces and soles, where melanoma is not uncommon. Assess both right and left sides of the body. The patient is turned over and the process repeated for the front of the body. When examining the face, turn the head from side to side and specifically assess the medial and lateral canthi of the eyes. Move the nose so that the nasolabial fold can be clearly seen. Check the lips and elevate the chin to examine both sides of the neck. Lift the arms away from the body and check the axillae. The genital areas are a very low incidence site of skin cancer and do not need routine assessment. Just ask the patient if they have any lesion in that region for which they would like your opinion. If appropriate, the lymph gland fields and liver can now be palpated. At this point, sit the patient up and reassess the important areas of the torso and the head and neck. The purpose of this is to see the skin with different light incidence and shadowing, which may reveal previously unseen lesions. Conclude by asking the patient to point out any specific lesions they remain worried by. Frequently our eyes will move across lesions without the slightest concern, yet they may be the ones that the patient has been most anxious about. In addition, this question will lead you to lesions that you may have missed. It also reinforces that we're interested in patient self-examination, for this is still the most common way in which melanoma is detected. While the patient is dressing, you should create an appropriate record. Make notes recording basic information about risk factors such as sun damage that may have been discovered, and about any lesion that warrant dermoscopy or special consideration.